working currently at Kamineni Children's Hospital, LB Nagar. So today we will be talking little bit about breastfeeding. World Health Organization and UNICEF, they recommend exclusive breastfeeding for first 6 months. That is not giving any other liquids or food other than breast milk. There are various benefits of breastfeeding. One, there is decreased infections in the ear, chest, diarrheas and flus, and it helps in fighting infection, promotes immunity and healthy development of the babies. It also builds emotional bond towards the baby and also vice versa. And there are less chances of autoimmune conditions, and better brain development is seen in babies who are given exclusively breastfeed, and they can sleep better. There is decreased risk of type 2 diabetes, ovarian cancer, breast cancer in the mothers. And various positions have been given for breastfeeding, like cradle cross, cross cradle, football, Australian hold, side lying, laid back. So depending on the size of the baby, depending on the size of the breast, and depending upon the mother's condition per se, various positions are given. So you can talk to your consultant regarding these positions and adjust accordingly. When you initiate breastfeed, initially the latch should be assessed properly. We should see latch and how the baby is holding on to the breast. So we should see that the baby is held close to the mother with tummy touching the mother's tummy, and the head, neck and spine are in straight line with wide open mouth and everted lips. Everted lips and lips itla bayatiki undadam with more attachment towards the lower side. So if this is the breast, then the attachment should be slightly more on the lower side rather than this way. So this will also give little bit of breathing easy for the baby. Otherwise the nose will close off if the baby is attaching this way. If the baby is attaching this way, then the baby's nose will be free to breathe better. Any painful breastfeeding has to be assessed immediately by your gynecologist, pediatrician or a lactation consultant, as there might be cracked nipples due to improper feeding. The process of milk production is a positive feedback system. Ante, the more you feed, the more breastfeed is produced. It also results in the production of a relaxing hormone called oxytocin. This suits both the mother and the baby. That is why immediately during feeding or post feeding, the baby also goes off to sleep and the mother also feels sleepy. Every year we celebrate August 1st to 7th as the breastfeeding week, and each year has a theme designed to promote breastfeeding. This year's theme is enabling breastfeeding, making a difference for working parents. So let's make breastfeeding work. So this is these are the various positions that we see in breastfeeding. The first one is cradle, where the mother is holding with the baby on one side and the same hand is used to support. In cross cradle, the mother holds the baby's head and the opposite hand is held to give the support. And this is called back lying, where the mother can rest little bit back and the baby is held from front. And this is called football hold. This is very helpful for mothers who have huge breasts and the baby is also very heavy. So the mother holds the baby like a football from the side. And this is called the Australian hold or the koala bear hold, where the baby is made to sit on the lap from the front and the mother can sit and feed the baby. And this is the side lying posture. Ideally, we do not suggest for going for side lying posture in the first 3 months. Later on, as the baby develops neck muscles, the mother can go for side lying postures. So this year's theme, we are going to discuss about making breastfeeding work for working parents. So this is the theme. So let's make breastfeeding work. So we know that many of the mothers nowadays are working and it is getting difficult for them to feed, and they are happening to not get too much of leave depending on the place they are working, and they have to take, either they have to come back from their maternity leave or they are losing their jobs. So this year the WHO says that women everywhere need paid maternity leave. So all women ideally should have at least 18 weeks, preferably 6 months plus paid maternity leave, paid time off for breastfeeding or expressing milk upon returning to work. So what this says is, first 6 months where the mother has to give breastfeed exclusively, please give them paid maternity leave. And also when they come back from breastfeeding and they are joining back work after 6 months, give them some paid time off. That is, give them some time off so that they can express the milk in the workplace. And breastfeeding is easier when everyone steps up to support the mother. This includes not just the family, not just the doctors, not just the nurses. It includes everybody in the society who is associated with the mother in some form or the other. So now today, this year, the WHO has guided that the employers and managers also have to step up to help in breastfeeding. So breastfeeding is easier when your workplace provides support and dedicated time, and also the space to breastfeed or express your milk. So a dedicated time should be given, and also a space where she can use little bit of privacy to either breastfeed if the child is brought to work or express her milk. The employers benefit by providing paid maternity leave, contrast to what employers think that they might be losing their quality time, or the mothers will be in touch with the baby and they might not do the work properly. So contrary to this, it has been proven that breastfeeding reduces the work absenteeism, it increases the participation of women in the workforce, and it motivates the staff and increases the productivity. So paid maternity leave is important for mothers. This supports the mother's choice to breastfeed. Breastfeeding reduces the risk of breast and ovarian cancer, and it improves the health, recovery and mental well-being of mothers. Paid maternity leave makes children healthier. It helps to establish and maintain exclusive breastfeeding, lets parents nurture and provide quality care to children, and supports babies' early development. So what can the employers do in this regard? Providing maternity leave, which I have already mentioned, and providing time and space for breastfeeding or expressing and storing the breast milk. Just a screen would do. A screen and a chair with a simple table is enough for the mother to express milk. And providing options that reduce the separation of mother from their babies after maternity leave. You can give flexible work schedules, on-site childcare, teleworking, part-time work, and letting mothers bring their babies to work. So friends, let us create a supportive environment where the mother is given support from all the angles. So not just from the husband, not just from their in-laws, or not just their mothers. So also from the workforce. This has been brought into utmost necessity now, because almost all of the women are working right now, and they are facing this difficulty where they have to join back. Either they have to lose their jobs, or either they have to go sit with baby feeding, giving breastfeed. So both the ways is not ideal for a mother, because either way she is going to land up in stress and the breastfeeding is going to come down. We have seen that if the 10 babies have to get feed, only 4 out of 10 are getting exclusive breastfeed till 6 months of age. So this is something that is really wrong, and it has to be picked up. Although many marketing is happening for breast milk substitutes and all, and it has been an exploitative marketing in fact, but we need to curb this out and promote and motivate the mothers more and more, and give them that support. Just using words to motivate them doesn't help in promoting the breastfeed. You provide the environment, and she will be there with the baby, she will be there for your company also working, and it will help the society to grow together. Thank you.